When we carry out our objective tests, I've mentioned, and it's also in your notebook, I like to use a kind of triangle of tests whereby I remove the control from the patient or the client. Basically, the initial tests I will look at for sort of any asymmetries or problems. As part of the observation, I will get them to do some functional movements like squatting or sitting and standing. This will give me my idea of what's going on with regards to the patient's ability to carry out functional tests. I then remove some of the control by basically getting to do movements that they might not necessarily want to do. Having done that, I will then go on and do the sort of passive movements and resisted movements, and those usually for the back I will need to do on the bed, because that will be including the PPIVMS and the sort of PAIVMS that I've mentioned in the workbook. When we're doing the active range of movement, one of the things we should really sort of be looking for is like the way that the movement is carried out, the behaviour, guarding, restriction, give. We can also do the movements in a sort of repetitive way, so we can get them to do the actual movement purely with a bit of overpressure, and then afterwards we can get them to do a repeated sort of movement. The main movements for the lumbar spine are flexion, extension, side flexion left and right, and a sort of side glide whereby you're moving the lumbar spine from the sort of more caudal aspect to the more cephalad aspect, or down from bottom up, so to speak. So basically what we will get asked the patient to do is, having observed them, get them to squat up and down with their legs. Just squat up and down with your legs and come up and down. And these are sort of functional sort of movements. Maybe we can get them to sit to stand. Now what I would ask them to do is a flexion. So if you can just flex forwards, just bend forwards, and if they can get all the way down without any sort of problems, I may do some sort of overpressure like this, but I won't do the overpressure as part of the test unless I really need to, and I can't really elicit any sort of pain. I will do the most provocative activity last. So say for example it was extension, I would do that last because I don't want to set off any pain processes. But for the sake of the video, we'll just go through them. So we've just done flexion with overpressure, and now extension. And again, be careful to block the hip. Be careful and get them to stand up straight again. Now, it's often the case that the patient is going to want to drop their hips forwards and their knees. So you need to make sure that's only from the back. So don't bend your hips, don't bend your knees. It's just coming from your back. Just bend backwards. You won't have as much range there. And stop and hold that. And sometimes I will need to hold them, support them, and just press like this. Now, side flexion to the right. Again, try not to move your hips, just from your back. And again, I can block with my pelvis and pull them into overpressure. Side flexion to the left, similar sort of thing. I would stand on this side to do it. Now, the last one, the sort of bottom up thing that we were talking about, basically make sure that they do not move the trunk, and they're basically going to slide their hips to the right and now to the left. We've actually done it right, left to right. So next time we're going to do it to the right and now to the left. And you can't really do so much with overpressure with that, but it's possible to do. So they're the basic movements. Again, you can do them repeated. So you can just bend forwards 4 or 5 times and come back and forwards 4 or 5 times. Usually don't do this with overpressure, because you're actually just trying to get to see what's going to happen with the repeated movement. And you can do the extension, side flexion and side glides in a similar way. So they're the basic active range of movement tests. They're very important. They're the basis of our objective assessment, because after that we're then going to go on and look at some of the other tests, special tests and passive range of movement tests, as I mentioned.